Okay, now we will continue with presentation of our CUPID action achievement. And in the next 1 hour, we will have opportunity to hear what has been done by Working Group 3 and Working Group 4 since 2022, when our cost action started. Our first presenter will be one of leader of Working Group 3. This is our colleagues and friends, Dr. Kate Sykes, and I will introduce her. Dr. Sykes is an academic with expertise in preventive health, specifically cancer prevention and screening, usually focus on people with learning disabilities or people with severe mental illness. Broadly, her research interests are in health inequalities, learning disabilities, avoidable and preventable death, health system, and access to health service. She also teaches on health-related undergraduate and postgraduate programs. Today, Kate will present on the work of Working Group 3. Also, she will deliver during the training school taster session tomorrow and participate in the panel discussion also tomorrow. So, Kate, the floor is yours.
Thanks, Dragana, and hello, wonderful colleagues. It's so lovely to see you all in person, because a lot of you we often just see on Teams or Zoom, so it's wonderful to be able to connect and see you all today and tomorrow. So as Dragana introduced, I'm going to give the Working Group 3 update on behalf of myself and Vera, who is Working Group 3 core-lead. Is that moving? Oh, yeah, sorry. So our main mission as part of Working Group 3 was to create a universal Europe cancer prevention strategy. When to do that, we had 3 key deliverables. So the first one was to develop a research agenda for European-wide cancer prevention, specifically looking at guidelines for people with an intellectual disability. We organised a training school about health systems and targeted cancer prevention and screening, and then we, as with all other working groups, had to liaise and worked collaboratively with Working Group 4. And I'm going to go through each of them deliverables over the next few slides. So the deliverables were very complicated and are very complicated for our working group. They are multifactorial, they cover screening and prevention, so we need to make sure that what we do covers that, okay, which is quite complex considering screening and prevention are quite different initiatives, okay? So we spent a lot of time at the beginning of the CUPID project kind of deciphering what we needed to do to be able to meet these deliverables. So we came up with a plan of how we might do that. So, and we broke it down into 2 kind of main tasks to make it easily digestible for us as working group members to kind of think, what are we doing, why are we doing it, and how are we going to do it? So the key thing within Working Group 3 is that we're taking knowledge and learning from Working Groups 1 and Working Groups 2. So the activities, the networking, the reviews that are ongoing, you know, the policy review that's happening with Working Group 2 is filtering all of that learning into Working Group 3 so we can create this research agenda to make it equitable for people with an intellectual disability across Europe. And to do that then, we will identify areas of research, okay? So these are specific research questions and potential designs that will help us in doing that research, okay? So again, quite a lot of work. So our approach so far, we've done kind of a number of things across the few years that we've been working together. And really early on in the early days, and I kind of forgot about this, so sorry colleagues, we did a cancer prevention workshop in Ireland and Turkey. That was our first kind of big activity as part of Working Group 3. So we kind of duplicated a cancer prevention workshop. We used the World Cafe approach, and we did the same workshop in Ireland and in Turkey. With a range of stakeholders within each workshop to really understand, well, what are the barriers for screening and prevention, and we kind of used them countries as a comparison, but ultimately we found very, very similar things, and we've now been able to publish that paper as well. I think we published it pretty quickly as well after the event. So we've used that as the foundation, if you like. We've had multiple working group meetings, and I want to take this opportunity to thank Sonna and Peter for your wonderful working group leader kind of ownership while myself and Viva were on maternity leave, and keeping the wheels turning for us there. And some of the meetings were held by yourselves leading that. So again, thank you, Sonna and Peter, for that. And we've kind of ongoing got a systematic review of reviews, and the words of that, it's been a lot of work. Okay, now I've got a presentation about that tomorrow, but I'll give you an idea about what that looks like. And all of that learning and all of that outer ring from working groups 1 and 2 will feed into the central ring, which is ultimately our final deliverable, which is our research agenda. One of our other kind of tasks was to have a training school, and we jointly held a training school in Trinity. Thanks, Martin, for hosting that. And like Martin alluded to, working groups 2 and 3 have worked very closely throughout this project, mainly because our deliverables are very similar and actually overlap in some way. So we held a joint training school there. So again, that achieved our deliverable. But again, the learning from that, the sessions that we had from that will feed into that research agenda that we're developing. So the systematic review of reviews, and just to say, I am never doing one of these ever again. Gosh, I know why there's not many published. So really, as we've kind of highlighted in the 5-minute presentations, lots and lots of people do reviews of some form, whether that be systematic or scoping, to really try to explore what barriers and what interventions can be done to help people with an intellectual disability engage with cancer prevention processes or go to cancer screening. So we're doing a review of reviews to bring all of that learning together. So we know that multiple reviews have been published that have slight differences, and we want to capture what are the main findings of that can help people with an intellectual disability prevent cancer in the first place, and then attend screening if they so wish to. So our 3 objectives there are to identify the barriers and facilitators in relation to cancer prevention. So similar to what Peter was talking about in his 5-minute presentation about the vaccination, that's what we're looking at in terms of that objective. The barriers and facilitators to cancer screening, and again, multiple presentations in the previous session talked about cancer screening barriers, so we're going to kind of pick what they are and what can help. And then lastly, identify research gaps and recommendations from the literature, because we have no doubt that there will be similarities across papers. So we're going to kind of bring all that learning together and say, these are the next research projects that we need to do. These are the designs. This is what kind of the roadmap for us as CUPID members, moving on past the CUPID project, but also for other projects, whether that be PhD students, master's dissertations. It will give us that plan about what we need to do and who with. So I'm not going to go into a lot of detail because I've got my session on this tomorrow. So we've searched 9 databases, we've done forward and backward citation searching multiple times, and currently at the time of this presentation we had 20 included systematic reviews that have been conducted. So we are looking at solely systematic reviews, not scoping, and a lot of the data that was in the kind of 3,615 records, some of them were scoping reviews, but we've gone with systematic. Okay. So like I said, the results of that I'll share with you tomorrow, but the results feed in directly to this research agenda. So the agenda is to develop EU-wide cancer prevention guidelines for people with an intellectual disability. So how we are going to do that is we're going to use multiple data sources. So we've got the 20 papers from the systematic review. We've got 7 documents from the CUPID website. So what myself and colleagues did a few weeks ago, we had a working group 3 meeting in Newcastle, where you all joined me in sunny England, which was a lot cooler than it was today. And we kind of sifted through the CUPID website, the outputs on there, to see if there were any kind of outputs that weren't primary evidence, to see if there were any that kind of met our aims of the agenda. We've then got, at the time of this presentation, 12 policy documents from Working Group 2 as well. So all of that data will feed together. We'll triangulate to kind of pick out the overlapping messages and develop what research needs to be done. What we decided as well at the meeting, this is why I've got my iPad, is the structure of what that research agenda might look like. Now, we couldn't find any specific guidelines on how to make a research agenda. That doesn't exist. So lots of publications say, here's a research agenda, which is fabulous, but don't actually tell you how to do it, or don't give you a framework. So we've kind of made our own framework for this. So the kind of plan for the agenda will have kind of an introduction, an aim, a methodology, so actually setting out how we've made this agenda. So again, thinking about replicatability for other researchers who might pick this up. We're not saying this is the best way to develop a research agenda, but it's our way and our way that we've done it. We'll then break it down into recommendations for a minimum standard and have a full section about that. So this might be things that are overarching considerations, okay? So these are things about how do we reliably identify people with an intellectual disability? So in England, we're quite lucky that we have a register of everyone with an intellectual disability. Well, we say everyone, those that have a recognised diagnosis, okay? There'll be lots of people in the community that aren't on that register. But that doesn't exist for lots of other countries. So how do we do that reliably across countries? Family and support attitudes. So again, multiple of the presentations prior to me speaking talked about the family support, the family's knowledge, the staff's awareness, the staff's attitudes of screening and prevention. They are things that will go across cancer screening and cancer prevention, okay? So that's why we're calling them overarching. And health literacy. Again, health literacy will affect both of them areas. Primary prevention, so HPV vaccination, sunscreen use, diet, physical activity, smoking, alcohol, and then cancer screening is a second one as well. So we'll have things that separate them out, but we'll also have that overarching aspect as well. And just to note that the majority of the outputs and data that we've got lean towards screening rather than prevention. Okay, so that's a key finding in itself. Thinking about the review specifically, there's no papers that talk about sunscreen use, for instance. So we know that that is potentially a key recommendation moving forward, that there's a gap in evidence about what do people with an intellectual disability think about how to use sunscreen, when to use it, etc., etc., etc. We will then have a section about knowledge, skills and competencies. So again, thinking about what do staff need to know? What do the people with an intellectual disability themselves need to know? What do carers need to know? And what skills do they need? Yeah, Natalie and I were talking during the last presentation about self-sampling, you know? So self-sampling has been introduced in the UK, and I know a lot of other countries have used that for cervical screening. What skills and competencies a family is going to need to know to now describe this new process, this new system to help somebody firstly decide if they want to do it, this new test, because it's going to be completely different to everything that they've been told previously. So that's just one thing that we might talk about in that section. And then the last section is kind of the one for the researchers and academics in the room, research questions and approaches. Yeah. So what are the gaps that we've identified throughout the whole of this CUPID project? And how can we reliably and effectively conduct that research? Okay, we're not going to give you the protocol, because that's kind of up to you guys to do, but we can say, you know, there's a gap in evidence about sunscreen use. So to address this question, here's the methods that we recommend and why. Okay? And again, how we've proposed to do this isn't the final version, is to think about uptake. How do we improve uptake? A lot of funders, and I've spoken to colleagues here today, that will say uptake is the only outcome measure that they're interested in. Yeah, which we know is an arbitrary outcome for intellectual disability research. But they want to see uptake being changed. So we'll have a section on uptake, a section on acceptability, and then a section specifically on interventions as well. Because again, a colleague said previously, most research will exclude people with an intellectual disability from interventional studies, and there's evidence to confirm that as well. So our next steps, we have a lot. So as a working group, these are kind of our next few months. So again, it might look like that we are behind. It's not, it's just our timescales are different to working groups 1 and 2, because we can't make the agenda without the details from working group 1 and working group 2. So we have got a busy few months ahead, but you know, we've worked collaboratively up to now, so we can still do this. So the main thing around the systematic review is to go back to the quality assessment, because we had a working group 3 meeting, and we think we might need to go back to some of the papers and use a different tool to do that, to then do some of the more in-depth data analysis there, and then hopefully a manuscript for publication, which has been started. But again, we can't finish that until we've got the results to write about. But tomorrow I talk about the preliminary findings from that. We've then got the agenda. So we've started to data extract from the sources already. Again, we're just waiting from the systematic review to confirm the results before we can progress that. But I spoke with Dragana just before this presentation. You know, from presentations today and even the posters at the back, there is learning that we can feed into that agenda as well. So especially thinking about kind of Peter's talk, there was a silence in the review up to now about HPV vaccination. So again, it's really important that we factor in, you know, what Peter's presentation from today, because that will still give us really useful data that we can feed into the agenda. Similarly, there was a gap in bowel screening as well, so a lot of the data leans towards cervical and breast. So again, we can feed that in moving forward. And what we are also planning to do is a consultation event. We'd originally planned this for it to be over the summer, but it might push into kind of September time. But we plan to still do this before the CUPID project ends. And basically what we're thinking about doing is holding a few online events where we look at the research agenda, we do some prioritisation work, similar to what Martin and Vladimir and Barry did in the last session around, well, what are the key priority areas? This is what we found for each country, for each kind of demographic, whether you're a clinician, whether you're a researcher, what are your priority areas and why? So we can kind of give a structure to the agenda. Instead of saying, there's everything, you know, we can kind of come up with some kind of way of saying, well, these are what we've identified as the most important research projects. Not just saying that the ones at the bottom are kind of the least important, but to kind of give some prioritisation to some of that. Okay. So we are currently planning that. So again, we'd be really keen to work with you all and involve people with an intellectual disability in some of that consultation work. So we'll probably hold an online event for as CUPID members where you all can join online, but we will be looking for people to go out to local advocacy organisations, support networks, and kind of give our findings to people to kind of say, well, which one is most important to you out of these topics, okay? Because again, thinking about what Suzanne said, nothing about us without us, we think it's really important that we involve people with an intellectual disability in that. I'll move on to the accessible summary, and then I'll take any questions after Vladimir's talk, if that's okay. So, our accessible summary, we have been working together to make a research agenda. A research agenda is like a to-do list. It identifies the most important questions to answer and maps out a plan for tackling them. The agenda will be to help people with an intellectual disability across Europe have cancer screening, and I should say if they want to, and reduce their risk of developing cancers. To make the agenda, we have had workshops and group meetings. We looked at what other researchers have done on cancer screening and prevention and looked at the work of other people in CUPID. We will find the important information and we will work together to find out what people can do to help and what is missing. The agenda will create recommendations for better cancer screening and prevention, will help healthcare workers learn how to support people with an intellectual disability. We're going to talk with healthcare professionals and carers as part of that consultation work, and we are going to speak with people with an intellectual disability across Europe to see what they think is important. If you have any questions, please catch me today and tomorrow, or there is my contact details on the screen. Thank you.